I'm an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf, and this episode is everything you need to know about why sex hurts and what you can do about it. Remember, this is not meant to be any type of medical advice. So if you have any questions about your health or if you're having pain with sex, make sure you go speak with your healthcare provider. And remember, this is not any advice on religion. So if you have any questions about your religion, make sure you go speak with your friendly neighborhood religious leader. This is the Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. So today we are going to talk about why sex hurts, why it can hurt sometimes. Remember, it's not supposed to hurt. Okay. So that's the first thing I want to make very clear. That's a myth that I heard when I got married. And that it was okay, that it can be uncomfortable, that it can be painful, all this stuff. It's not supposed to be, okay? I want you to know that. So if you are having pain every time you have sex, make sure you go and get it evaluated, right? Go and get evaluated. Do not deal with painful sex. I mean, why do you need to do that? You're not going to get a medal or something like that. So make sure you get evaluated, right? So if you're having pain, just go get it checked out. All right. So if sex hurts, then it's going to damage the relationship. It can damage your marriage, and not because of the lack of love, but because people can sometimes feel rejected. They can feel ashamed. They can feel broken. And so it's important that, we know and everyone knows that sex is not supposed to be painful. Okay. So I want you to just kind of burn that information into your brain and know that it's not supposed to be painful. And if it is, then let's figure out why. Okay. So pain is a signal, and that there are real diagnoses and treatments that, somebody can get. So if you're having pain, get it checked out. Okay. So how common is painful sex? So population data shows that painful sex is not rare, okay? In a large probability survey in Britain, about 7.5% of sexually active women reported painful sex. And among those, about a quarter had symptoms very often or always for the last 6 months, okay? In a US-focused clinical summary, painful sex was cited at about 10 to 20%, was found in about 10 to 20% of women. Okay, that's a lot. That's a lot of women dealing with painful sex. So I want you to know, you're listening to this episode, I want you to know that you should not be having pain with sex. Okay, pain during sex is one of the most common reasons people quietly stop having sex, right? And one of the least common things that people talk about, because it's embarrassing for some people, right? They just don't want to talk about it. And in fact, I'll tell you, when I have patients that come into the clinic and see me, and when I ask them about sex, some women are, open and really excited that somebody's finally asked them about sex, but other women are really hesitant to talk about it. And they're just like, well, I just don't want to talk about it, or I don't feel comfortable, or can we talk about something else? And so it's really important that, you become empowered, and that if you're having pain, that you can talk about it with somebody, right? That you can talk about it with your doctor. And if your doctor feels uncomfortable, then you should find another doctor, somebody that doesn't feel uncomfortable talking to you about sex. Some people assume that pain is normal and they think that they should just tolerate it. And I want you to know that you should not tolerate it. You shouldn't have to deal with it. Okay. The pain during sex is called dyspareunia, and that's the medical term for it, but it's a symptom. Okay. So I want you to know it's not a character flaw. It's not, a lack of faith, or that's something that we should just push through. And so here, let's talk about a little bit of, why that happens. So there's no just one cause, right? There can be lots of causes why people experience some pain with sex. It can be, some benign conditions, some things that are super easy to treat, and other things that, take a little bit longer to investigate and to figure out why you're having this pain. Okay. We divide it into two categories. One is superficial pain and one is deep pain. So superficial or pain can be pain that is at the vulva or the vaginal opening, right? That could be at the outside or just at the opening of the vagina. And then there's deeper pain. That can be pain that is felt deep inside the pelvis with penetration. Okay. And some people can have both. Some people can have these overlapping causes. Maybe they have both. Maybe they have in superficial pain, right? Let's say they have vestibulodynia, which is pain with entry right at the opening, which is the vestibule. And, once they have that pain, then they have something called vaginismus, where, their muscles tighten up around the vagina. So, right. So you can have a mix of those. It's not like one or the other. It can be all if you've been having a lot of pain. But understanding where the pain is coming from is really what is the most important thing, right? And when it occurs is really the first step to finding you some solutions, okay? So some of the most common causes of pain that we have, one of the biggest ones is the genitourinary syndrome of menopause. Remember, this is what happens when we have decreased estrogen in after menopause, right? So what happens? Well, our estrogen in perimenopause is like fluctuating, right? The estrogen is going up and down. But once we hit menopause, that estrogen goes all the way down to zero. Okay, so the women, we don't have the estrogen that we need. And we know that estrogen helps with lubrication. It can help with that tissue becoming more plump. And so what happens, right? So during this menopausal state, right, the tissue becomes thinner, it becomes more dry, becomes less elastic, it can become more fragile. Okay. And I tell women in my office, and I have this puppet, and I wish I would have brought it while doing this lecture. But, anyways, inside the vagina, there's what we call rugae. Okay. So it's kind of like you've seen those ruffles chips, right? It's kind of like those little ruffles in them. So that's kind of it. So inside the vagina, if you were to look, there's like these ruffles, and that allows the vagina to expand and contract. Okay, so without pain. Now, as we get older, as we get into menopause, that estrogen decreases, and so those rugae, right, those ripples or those ruffles that we had inside the vagina, we start to lose those, and so it becomes straight. And so once you start losing those ruffles, then that vagina doesn't expand and contract as well as it used to, and so that can definitely cause pain with sex. Okay, you can have pain with penetration, you can have burning, sometimes bleeding. There was an article now I think it's like, gosh, I want to say it's maybe even 2 years ago. But anyways, it was in the Guardian. There was an article about a woman that talked about how long she had suffered with this genitourinary syndrome menopause, right? This burning feeling, this uncomfort, this discomfort every time she sat. And she wasn't able to get help because every time she went somewhere, nobody could figure out why she was having this pain, this discomfort. And so finally, she went to some practitioner that was able to tell that she had, this genitourinary syndrome menopause. She got estrogen and vaginal estrogen. It really, really made such a huge difference because this whole time she'd actually like quit like 4 jobs. She hadn't worked. She was in such pain and misery, and she didn't know what was going on. So really, really important to remember to always get vaginal estrogen as you get further along in midlife. Okay. So, genitourinary syndrome menopause affects about 50% of women. And you know what I think is so interesting, that some women will be like, oh, I don't need it, I'm not having any issues. I'm like, believe me, you will have issues. And it gets progressively worse, right? So if you go, the longer you go without it being treated, it's going to feel worse. So make sure you go and get treated and get the medication that you need, right? So approximately 50% of people within 3 years of menopause, remember, 3 years of menopause are affected with this genitourinary syndrome menopause. And it's not only in menopause. Remember, anything that is a decreased estrogen state. So the women that are breastfeeding in your lives, right? They can be experiencing this too, because remember, the estrogen goes down so to allow the milk to come in the breast. And so when that happens, they're in this decreased estrogen state. If that happens, they can have the same symptoms in breastfeeding, right? And so my friend coined a term called genitourinary syndrome of lactation. So it's similar to menopause in that it happens when there's a decreased estrogen state, but this is for women that are breastfeeding. So remember, if you know somebody in your life that is breastfeeding that's complaining of vaginal pain or pain with penetration or dryness or discomfort, have them go see their doctor and get a prescription for vaginal estrogen to help with that lubrication, to help with that tissue so that they don't have that pain. Okay. All right. So you can also have this in somebody that has thalamic amenorrhea, and also women that are taking these aromatase inhibitors when they have breast cancer. Okay. So this is tissue level biology. It's not anxiety. It's not lack of desire. It is pain that is happening due to this lack of estrogen that they have in their bodies. Inadequate lubrication is another reason why women have pain with sex, okay? And it's super common. And this can happen because either there's, insufficient arousal time, there's anxiety or fear, there's hormonal changes or medication side effects, okay? We know that antidepressants, SSRIs specifically, are well known to decrease desire, sexual desire, impair genital sensitivity, and also delay or prevent orgasm. Okay, so it's really, really important that if you know somebody that is on these medications and that is having a problem with lubrication, that it's not their fault, it's due to the medication that they're on. And that the dryness plus friction, right, is going to equal pain. And so, what do these individuals need? They probably need some lubricant to help during sex. So that's really, really important. Also antihistamines, so anything that dries out, right? So sometimes people are antihistamines because it's, allergy season, they have a lot of allergies, whatever. And so they take these antihistamines daily. Well, that can also prevent adequate lubrication. And so it's important that if you're taking that, to always make sure that you use lubrication when you have sex, okay? All right, now, number 3, vulvodynia or vestibulodynia. Okay, so vulvodynia, what is that? Vulvodynia means pain at the vulva, and vestibulodynia is pain at the vestibule, okay? And provoked vestibulodynia means that it is something that touches the vestibule, causes pain, okay? So vulvodynia, which is pain at the vulva, is a chronic vulvar pain without an identifiable cause, but you can have identifiable. There can be reasons why you have pain at the vulva, right? It can be recurrent infections. That can be one of the most common reasons that people get it. It can also be using detergents or something that causes sensitivity at the vulva, right? So there can be a nerve issue. It can be a pelvic floor issue. So there can be a lot of reasons why people have pain in the vulva. It's estimated that about 12% of individuals sometimes get misdiagnosed or dismissed, right? And then let's talk about vestibulodynia. So vestibulodynia can happen, right? Pain at the vestibule. People that are on birth control pills can absolutely have this condition. And in fact, I had a recent patient that had been on birth control forever. And so she came in, I was doing her vulvar exam. I did the Q-tip test on the vestibule, and I noted that when I touched it, she had a lot of pain. And I explained to her that it's because she's been on birth control for a prolonged period of time, and it has downregulated her own hormone receptors and made that tissue very sensitive to touch. Okay, there are some people though that are born with this vestibulodynia, right? And so it's really important to go and be evaluated. So how do I know if I have this vestibulodynia, right? Like, what is that, right? So that was pain on entry into the vagina. Okay, that's the vestibulodynia. How do you know if you have it? Well, if you have always had pain inserting a tampon in, if you experienced pain upon insertion of, let's say, a sexual toy or like penetration, right, when you are having sex, that can be a sign that you may have this. So it's super important. If you are feeling this, if you're having this, to go and get evaluated, okay? It can be localized or generalized. It can be provoked or spontaneous. If you have vestibulodynia, right, at, let's say it's at like 5 through, if you imagine a clock, right, the opening of the vagina, imagine it that it's a clock. And if you have pain, let's say at areas 5, 6, 7, So that's where the pelvic floor muscles are. Then it could be that you have these tight pelvic floor muscles. Okay. So that could be causing pain. So important that if you are experiencing this type of pain, that you go and get evaluated by your doctor. And if your doctor doesn't know, go see a sex med doctor. Pelvic floor dysfunction. Okay, great. So, we're talking about that. So if you notice that you have pain at 5, 6, and 7 o'clock of the, when you're looking at the entry to the opening, right, of the vagina, and you have pain at the bottom part of it, then that can signify pelvic floor dysfunction. And that's a major contributor to painful sex, right? We know that sometimes you can have reflexive muscle tightening, you can have guarding in anticipation, right? Or involuntary muscle spasm. And a lot of times that's what we call vaginismus. But it's really important to know that if you're experiencing that, penetration may feel impossible. There are some patients that when they have this vaginismus, their partners feel like they're hitting a brick wall, right? Like every time they try to have penetration, the muscles tighten up so much. And so it's important to go see a pelvic floor therapist. It's important to go see your sex med doc. And it's important that if you've had this for a long time, that obviously could be affecting you mentally as well. So you want to make sure that you go see a sex therapist, right? So important that pelvic floor dysfunction often coexists with fear or prior pain, right? And it becoming a vicious cycle. So you have this pain, and then you have this fear that every time you have penetration, it's gonna be painful, and so then the muscles tighten up in anticipation of some type of penetration, and then you have that pain, right? So it's just like this cycle, this vicious cycle that happens. So you gotta make sure you go get that evaluated, okay? It's not something where, and I've heard patients say that they were told by their doctor to just relax or drink a glass of wine or something like that. It's not something that you can just push through. Okay. You got to get evaluated. You got to get treated. Number 5, another reason why people can have painful sex is vaginitis, right? So if you have an infection in the vagina, okay, of course, obviously that can be a cause of painful sex. Okay. Some of these infections that sometimes happen in the vagina, we have bacterial vaginosis, you can have yeast, you can have trichomonas, you can have gonorrhea, chlamydia, syphilis, like any one of those things, right? But anyways, the most common causes, honestly, that I see for pain at the vulva is either the number one reason that I see is yeast, is candidiasis. Okay, and sometimes people that have yeast can show up as like a thick white discharge. It can be itching. It can be vulvar redness. Trichomonas sometimes can also cause like this frothy yellow-green discharge, irritation, odor. So these are conditions that, when you have it, you go and you get evaluated. We'll do a swab. Or if we know that you have it, then we'll treat you for it. Okay. Number 6. Okay. These are really important. Okay. So make sure that you're listening. Is that you can get lichen sclerosis, you can have lichen planus, or you can have lichen simplex chronicus, okay? And lichen sclerosis sometimes can have severe itching. I did a whole episode on lichen sclerosis. So if you don't know, make sure you go check out that episode, okay? And you can have severe itching with that. There's some scarring that can happen with that. Lichen planus can affect the vulva and the vagina, and lichen simplex chronicus is this itch scratch cycle that needs to be evaluated. Okay, these conditions absolutely can cause pain and tearing and scarring and bleeding with lichen planus. I've seen it. I had a patient that had lichen planus, and she had bleeding every time she had sex. Nothing. I mean, it was awful. She was like this, and then she got like a secondary infection. So really important to be evaluated. Okay, so these are treated primarily with steroids, and lichen sclerosis requires long-term monitoring because sometimes it can go to vulvar cancer. Okay, so you have to make sure that you're being followed for that. Okay, number 7, some deep causes. So remember, we started with some superficial causes, right? So things that perhaps are only on the outside of the vagina. And then now we have some deep causes, right? So endometriosis, adenomyosis. What are those things? So endometriosis is where you can have these lesions, right? These lesions that can form I mean, they can do so many things. They can cause scarring to happen inside of the pelvis. They can form these chocolate cysts. They can cause the tubes to not work properly. I mean, they can cause a lot of problems, but they can definitely cause a lot of pain within the pelvis. Okay. Adenomyosis is when you have this basically blood that is going into the muscle of that tissue of the uterus. And it can cause a lot of heaviness, right? It can make the uterus feel really heavy. It can also cause pain with deep penetration. And so you want to make sure that you go and you get that checked out. They can cause some heavy bleeding, it can cause some chronic pain. Adenomyosis is being diagnosed more and more often. So you really want to get that evaluated. And, just if there's anything you can get done, you want to get it done because those things can cause a lot of pelvic pain. All right. So those are some of the causes of superficial pain with sex and then deep pain with sex. Okay. So now diagnosis. Now, what is it that we have to make sure that we rule out? So as clinicians, we always have to make sure that we rule out malignancy, right? Painful sex can be a symptom of malignancy. It can include is the cervix bleeding every time I have sex? Remember, I did that episode on bleeding after sex. So you want to make sure that there's no cervical cancer, there's no vaginal cancer or vulvar cancer, or ovarian or endometrial, any one of those cancers, right? Is that you want to make sure that you don't have a pelvic mass or anything like that, right? Inside of your pelvis that could be causing pain. You want to make sure that if you have some abnormal bleeding, you get that checked out. You want to make sure that you get an ultrasound, all of those things, right? Depending on wherever that pain is, your doctor's going to know how to evaluate you. So I'm just telling you things that can be done. Doesn't mean that all those things are going to be done. Okay. Also, pelvic inflammatory disease. We always have to make sure that we rule that out. Okay. If you're having pain with sex, when you go to your doctor, sometimes what we'll do is if you're complaining of, let's say there's discharge or irritation or something like that, and you're having pelvic pain, what we'll do is we'll do a swab and we'll test for, things that cause pelvic inflammatory disease. And, some of the most common ones are chlamydia and gonorrhea. And so we'll do a swab, we'll test for that. Also, we'll do an exam. So it's what we call a bimanual exam. We'll check your uterus and your tubes and your ovaries. And if there's pressure, there's tenderness when we touch your cervix, that's called cervical motion tenderness. That can be a sign that you may have this. And then also, if you have tenderness over where your tubes and ovaries are, sometimes that can be also a sign. So anyways, we'll always make sure that, if you're complaining pain with sex and discharge and some pain over your tubes and ovaries, we'll make sure that you don't have this. Of course, another reason for pain with sex can be sexual trauma. Any type of trauma or abuse can also present with pain with sex, genital injuries. And so we always want to make sure that, we make that you are safe as a person. And so, we'll ask about your history and what's going on. And so how we evaluate for painful sex, of course, we'll always do a history. We'll ask you how long this is going. Is this new? Is this old? Does this been happening forever? Location, your menstrual cycle, all of that stuff. Medications, are so important. So make sure you always tell your doctor or your provider what medications you're on, because medications definitely can be a source of pain with sex. So make sure that you let your provider know. Also, we'll ask about any type of medical conditions that you may have. We'll do an exam. We'll examine the vulva. We'll do a Q-tip test, all of that stuff to see where this pain is, where, can we elicit it, all this stuff. We'll do a Q-tip test of the vestibule. We'll do, any type of cultures that need to be done, all of that stuff. And, we'll order an ultrasound if we need to. We don't always need to order an ultrasound with pain with sex, but if you are having, pain with penetration, deep penetration, we'll order an ultrasound. Maybe we'll need to order an MRI if this has been a recurring problem. If you feel heaviness, maybe you have some fibroids, all of that stuff, we'll check that out. So what are some solutions? So you're having this pain with sex, you want to know what you can do about it and how soon it can get fixed, right? So depending on what it is, right? So it depends on, is it Does it only happen sometimes? Does it happen all the time? Depending on what the cause of that pain is, that's how we're going to tailor the treatment. So if it's due to inadequate lubrication, obviously we would, suggest that you get a lubricant. If it's due to the genitourinary syndrome menopause, we're going to give you, vaginal estrogen. If it's some irritant that's causing this vulvodynia, we're going to ask you to avoid that, right? So depending on what it is that's causing your pain, that's what's going to tailor your treatment. Vulvodynia, also, if you have tight pelvic floor muscles, right, we're going to ask you to go see a pelvic floor therapist. We're going to ask you to maybe even work with a sex therapist if you have vaginismus, right? If you have all of these thoughts that you're always going to have pain. If it's an infection, we're going to treat that infection, all of those things. So the most important thing that I want you to get from this episode is that if you are having pain with sex, that is not normal. Make sure you go and get evaluated, right? Don't let people tell you that pain with sex is normal. It's not. Get evaluated, get treated, find out what's going on, take ownership over your health, and feel better, right? That's the most important thing, is that you feel better, right? It's not something that you should be ashamed about. You should be able to talk about it, speak with your provider, find out what's going on, right? And your body is communicating with you when you have pain. I always say this to a patient, because I have this patient that has this recurrent vaginal infections, right? So when I talk to her, when I ask her how her vulva is doing, and she has to even think about it, that tells me she's doing okay. And I tell her that if there's a body part that you are not thinking about, that means that body part is okay, right? Like when you have pain with something, then it's always throbbing or it's hurting, whatever, you're always aware of that body part. So if you're not aware of it, that means you're okay. So I want you to know that sex should not hurt. If it does, get evaluated, get treated, because it should be pleasurable. It should not be painful. And if you know somebody that could benefit from this podcast, I want you to share it with them. I want you to let them know about it, because that's the way that we empower others, right? We empower with education. And so that's what I want you to do. And well, this has been real and really intimate. Remember, this is not meant to be any type of medical advice. So if you have any questions about your health, make sure you go speak with your healthcare provider. And until next time, this is the Muslim Sex Podcast. So thank you for listening to the podcast, and make sure you leave us a review, share and like the podcast. And if you leave me a review, I'd love to shout you out on social media. So be sure that you share it with all your friends. And thanks for listening.